There is always so much to go over when you have lupus that it can easily take a year of appointments with your doctor to cover everything. In clinic, we tend to focus on joints, labs, and medications, and that is enough to fill the 15 minutes that we get. But this can leave many issues underappreciated and undertreated. So what I'm going to do today is discuss all the possible lupus symptoms that happen from the neck up. The malar rash and hair loss get a lot of attention, but there are a lot of other things that happen from the neck up that you need to know about. So today, let's do a head-to-neck review of lupus symptoms, how to tell if you have any, and what you can do about them. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Like I said, hair loss in lupus gets a lot of attention, so it's likely not a surprise it's on the list. Hair loss in lupus can either be diffuse hair thinning, patchy, or associated with scarring. If the hair loss is associated with skin color changes or scarring, it is most likely discoid lupus, which is just another flavor of lupus. Discoid lupus is a skin-only version of lupus, although there is a subset of those with discoid who will get systemic or full-body lupus, and vice versa. The hair loss and thinning that can happen with lupus gets a lot of attention because it can be quite distressing. Even when facing kidney, heart, or brain issues, many will have concerns about their hair and when they can expect it to grow back. I'm going to be honest with you. It takes a long time and often doesn't come back to the same thickness as prior to lupus. The best treatment is controlling the lupus overall, although sometimes getting what we call intralesional injections in the scalp where there is hair loss can make a difference. Hair supplements can also be helpful, but again, nothing works overnight. Moving from the scalp to the brain, we now have to talk about headaches. Headaches are very common in lupus and are underappreciated and sometimes frustratingly difficult to address. You will often hear me refer to major organ involvement in lupus, and that usually means when lupus is causing inflammation in the kidneys, lungs, heart, or brain. Well, brain inflammation from lupus can take many different forms. In some, it can mean there are personality changes and significant psychiatric symptoms. In others, it can mean there are strokes, blood clots, or blood vessel inflammation, and in others, it can mean there is actual inflammation seen in the brain or in the tissue around the brain. In all of these possibilities, headache can be one of the symptoms that someone feels. But sometimes we see none of those things on MRI or CT scan or any of the other tests that we do, yet someone with lupus will have a headache. Does that headache mean there's brain inflammation? This is a question I cannot answer. No one can. We know that treating the headache with more lupus medication doesn't always work, so that would point against it being a consequence of more inflammation. There is data to show that headaches aren't any more common in lupus patients than the general public, which has made the idea of a lupus headache controversial. But I can attest, as someone who has seen a lot of lupus, it can definitely be a thing, and it needs to be addressed because regular headaches can definitely do a number on our quality of life. Right now, the recommended approach would be similar to anyone else with a headache. Look for signs of migraine, use anti-inflammatories and Tylenol, and if needed, see a neurologist who's a headache specialist. One of my mentors during training was a lupus expert, and I remember when I was telling him about a patient with this nagging, persistent headache, he just said, "You know, lupus headache is a thing and it can be quite bad." And then he just walked out of the room before telling me what to do about it because he didn't know. I've talked a lot about dry eyes on this channel in other videos, so I won't go too deep into it here. But having dry eyes is very common in lupus. It can be from either lupus itself or from having secondary Sjogren's disease, but regardless, what you feel is the same. Eyes that are dry, scratchy, red, irritated, or maybe even overly watery. Treatment is generally going to be focused on keeping the eyes lubricated, but again, I've got a whole video on dry eyes specifically where I get into all the ways to treat it, so I recommend watching that next, and the link will be in the description box. So one area on the head that isn't usually impacted by lupus is the nose. I've had people tell me about changes in their ability to smell, but that is not something that is common enough to even be reflected in the literature. I was surprised to find an article from 1980 that said septal perforation has been a diagnostic criteria since 1971. And like, what? This is not currently a criteria for lupus, and although it can happen, is not common and just goes to show how far we've come in understanding lupus. One symptom that I know is likely more common than we fully appreciate and is not getting the attention it deserves is hearing changes. Hearing loss is estimated to be seen in a quarter of lupus patients. Why this happens is still unclear. Is it due to antibodies attacking the inner ear, or is it due to blood vessel inflammation in the ear? We don't know. Management of lupus-related hearing loss requires closely working with an ENT and a rheumatologist and will likely require increasing your lupus medications, although it's still unclear how effective that approach actually is. There's still a lot of work needed to understand this, but the first step is identifying it. So if you are noticing any hearing changes, make sure to bring them up with your doctor. And if they say it's likely not related to your lupus, I have a 2021 review article linked in the description box you can print out for them, just as a gentle reminder that, hey, this can happen. But it's not just the inner ear that can become inflamed. The outer ear can too. This is a symptom that people will have and not even realize it can be related, and that is inflammation of the cartilage of the ear. This is called chondritis and is not specific to lupus, but can happen in lupus. The outer cartilage can become hot, red, and tender and visibly look swollen. We have a number of other autoimmune conditions where this is more prominent and can lead to permanent damage to the cartilage that changes the shape of the ear. Now, this doesn't tend to happen in lupus, but it can be inflamed nonetheless. Again, not super specific for lupus. I actually developed this in my right ear after I got these piercings. It happened off and on for the first year I had them, and it always seemed to happen when I was sick, which was really weird, but eventually went away. Anyways, if you have lupus and this happens to you, pay attention to it and bring it up with your doctor. It can be another way your body is telling you something. Now, a symptom that is still part of the criteria is the presence of oral ulcers. Getting mouth ulcers or sores is very common in lupus, with more than 75% of those with lupus getting them at one point or another. These ulcers can be painless or painful and are usually found on either the hard or soft palate. That means they are usually on the roof of the mouth, either in the front or the back. This is different from the more common canker sores we can get, which can happen on the inside of the lip or on the gums. Those ulcers are usually always painful and have a red halo with a yellow or white middle. Treatment of lupus oral ulcers is usually tied to treating the entire condition. However, using some topical treatment like lidocaine or even steroids can help with the pain. Dry mouth, just like dry eyes, can occur in lupus, and as a consequence, cavities and other dental problems can arise. So it's always important to keep up with your dental visits when you have lupus. We know that lupus can cause joint pain, and when we think of joint pain, we usually think of our hands or our knees. But our jaw is a joint, and we can definitely get pain and inflammation there as well. This tends to go up and down with the arthritis and other parts of our body, but not always. And this can lead to headaches, difficulty chewing, and just general misery. Treatment would be just like arthritis anywhere else, and some doctors can even do injections into the TMJ directly to control inflammation and pain. If you've ever been sick with a cold or the flu, you most likely have felt your lymph nodes under your jaw, behind your ears, or down your neck. When I talk about our immune system, I am often envisioning this amorphous part of our blood that is made up of lots of different cells, but the immune system actually does have an organ, and it's the lymph nodes and spleen. Our lymph nodes and lymph system create a complex network that connects our entire body together and serves as hubs for our immune cells. So when we get infections, we can often feel lymph nodes in the area of the infection get inflamed. Well, when we have lupus, and especially when it's active, we can get enlarged lymph nodes. We can often feel them in more places than just under our jaw, like our armpits or groin, but it's not uncommon for people to point out new lumps or bumps they feel under the jaw. It's important to notice these and keep an eye on them. If they are from your lupus or any infection, they will feel soft, sometimes squishy, and maybe even tender and be movable, in that you can roll them under your fingers. If they don't go away after a few weeks, or they are hard, don't really move, and aren't particularly tender, then definitely let your doctor know. And then, of course, we can't forget about rashes. There are all kinds of rashes that can happen with lupus, but the main one is, of course, that malar rash. This is a red, slightly raised rash that can happen across the face, over both cheeks, and the bridge of the nose. It is important to note that the nasolabial folds are not included in this rash and tends to be more than just flushing of the cheeks. This shape of the rash is the reason it's called a butterfly rash, and that is why butterflies tend to be the symbol for lupus. This rash can flare with stress, UV exposure, and just as a sign of lupus inflammation, and the best treatment is to treat the underlying lupus, while of course protecting your skin from the sun with SPF. So as you can see, there is a lot to discuss when it comes to lupus that was just from the neck up. Many of these symptoms can get brushed under the rug, and we are left to deal with our headaches, our hearing changes, or our hair loss on our own. So if you are having or think you may have any of these symptoms, take note, pay attention to any triggers that make them worse, and bring them up at your next doctor's appointment. My aim is to provide you with trustworthy autoimmune information you can use to make the best health decision for you. If that sounds good to you, make sure to subscribe, and if you want to make sure you never miss another video on lupus again, make sure you sign up for my newsletter. Subscribing to the videos no longer does the trick and doesn't necessarily guarantee you'll see what I put out. So to make sure you don't miss anything, you'll definitely want to get on my newsletter. Thanks so much for watching, and I'll see you next time.